there's like two things. One is that I've had people who noticed that I was losing weight, but then were like, but you look younger, which was obviously a great benefit. But the thing was starting to feel like myself again, like the person I used to be 15, 20 years ago. I think that that's been kind of a great byproduct. I don't know that I was exactly looking to do that initially, but I take it for sure.
So what did that, like, walk me through that process? Like, how long did that take? Like, when did you start noticing that?
I would say 3-4 months in.
Yeah.
I think it was kind of a slow roll, and it's not like you get hit in the face very quickly with a change. It's kind of little stuff and little things, and you go, oh, I can do this or whatever. Yeah. And I was turning 60, and that was sort of, for me, it's a big number, and it was a little overwhelming to be 60, because I think for a lot of people, or for at least in my head, it was old. But I also conversely have an aunt who's 99, about to turn 100.
Wow.
And I have a grandmother who lived to 100. So I kind of thought, oof, I could do another 40 years on this planet, and I don't want to look like they did. Nothing against them, but I'd like to be more upright and be healthier and be more active and not have all these restrictions. And I have issues health-wise, and I just think that, well, Western medicine's great. You don't always have the opportunity to really address certain little things that can have a bigger impact over time.
Yeah. I think a lot of people come to us after they've kind of went through conventional medicine. What were you looking for when you came to MedMatrix as far as like more with healthcare?
Well, I mean, I have Crohn's disease, and so you have some sort of a drug that has all these other side effects and more prone to sinus infections and this, that, and the other thing. And I really wanted to try to keep myself from being sick all the time. And it's not even all the time. It's just I feel like anytime I see somebody sneeze, I want to run because I'm so concerned about getting sick. And I've been lucky enough not to have had COVID, but I made it through this whole season with my kids got the flu. I didn't get the flu. So I feel like.
Do you think your immunity's been stronger?
I think my immunity has definitely gotten better. I mean, just from, I don't hide. I'm not hiding in my house, and therefore I'm not exposed. And like I said, 2 people in my house had the flu, and it was bad, and they were in bed for like a week each. So.
Okay. Yeah. Can you talk a little bit about like some of the things you did at MedMatrix? Like talk about like the initial testing and kind of like some of the treatments.
So the initial blood work was actually very, very different than what I saw at a regular doctor's office. And one of the things that Dr. Rose and I had talked about, which is just because you're in this normal doesn't necessarily make it normal or okay, because sometimes if you're at the very low end, even that is not considered to be good. So I've had some iron issues, and we're working on trying to fix those things. And I think conventional medicine, they're working within the parameters of insurance and what insurance will or won't pay and what they will or won't do. And so they're a little bound and gagged, so to speak, by what they can do or recommend. Sure. And I've always been somebody who's thought outside the box medically. I believe in homeopathy and massage therapy and Reiki and all these other things. And this suits me in the ways that my regular doctors don't.
And that was a great way of explaining it. So with you mentioned just like feeling like yourself again. Can you, because that's different for everyone, like what was that for you? Like just kind of like, can you expand on what you mean by
that?
Well,
I definitely feel like, for instance, I have more mental clarity. I mean, I'm always a little foggy, and I think that I could go back to being 8 years old, and that's just how I am. I'm a little like in the clouds, but I feel like I can kind of rein myself in a little better than I was able to without changes in my regular Western medication. So that is I think the benchmark of what is or isn't working. I definitely think my skin has improved a lot. And I have good skin to start, but I think that my skin has improved. And I actually don't, while I do lose hair like every human being does in the shower and all that, I think it's actually slowed down a little bit, which is probably a good thing. And some of the things that I'm doing, because I also lost weight, I'm working on body fat, and that has actually decreased a lot, which all around is a great thing.
Yeah, nice.
And I find I'm in like a place where physically, as far as what my weight is good. I'm not trying to be a stick, and I don't, and we had the conversation today about, weight and those sorts of things and what's going to be healthy, and I'm happy with where I am. I'm not trying to be a supermodel. I have realistic goals, not.
Yeah. Okay. And you feel like, were you trying to lose weight before you came?
I had, and I've lost weight. I've lost, I think, since I started here, I've lost like 30 pounds, somewhere in that range.
That's awesome.
Yeah.
Yeah, that's huge.
Yeah, I mean, altogether, I think I've lost, since I've started working on any of it, 50 pounds.
So, okay. Yeah. What was kind of the support like with the medical team, just from like Dr. Rose and the nurses?
Well, she's great. I love the availability of being able to have telehealth as well as being able to come in. I think it's nice to be able to do both.
Mm-hmm.
I don't live far enough away that it's a problem, but
Yeah.
I also think sometimes your life gets in the way, and being able to just have a telehealth visit is
Yeah.
great. I have very good response whenever I put anything into the portal.
Mm-hmm. You work with Chantel, right?
Yes, with Chantal. She's great, and I actually, and like within 12 hours, I have an answer, or I'll get back to you because I can't, I don't know, or whatever. The medications all get refilled right away when I ask for it. So there haven't been those kinds of glitches that I've experienced other times with my regular doctors and that sort of thing. Mm-hmm. And I love getting my medicine at home, to be honest. It's just one less trip off my hands.
Yeah, 100%. And then, so we're just curious, were you familiar with peptides before you came to MedMatrix, or did doctors educate you?
I was vaguely familiar with them. I mean, I had started doing some research, but I didn't really know who, what, where, when, and how. But it's amazing when you start to talk to people want to know about it,
mm-hmm. and
I can explain to them, like, you know what, this is what you should be doing. So go see someone, and I usually will tell them about it. But it's funny because a lot of younger kids are into this stuff now, and it's fun to, like, when I say that, they're like, oh, like, as if,
you're on peptides.
And they're like, which ones? And I start to tell them, we have these conversations. So it's kind of cool because, like, my daughter this doesn't register for her, but like she does realize that, like, I'm not 700 years old and that I'm paying attention to things. So
thank you for sharing. The last question, I guess, are just around like that quality of life, like what you mentioned, just feeling like yourself again, like what did that change for you personally, whether it's like just being more engaged or like being more
I
active?
also think energy for me was a huge thing. I've had issues with it, and obviously I'm postmenopausal, so there's all of the things that go with that, and I think that getting out of bed was sometimes a little like drudgery. Just my old self was more of an Energizer bunny and like go, and I find myself in my house. I've been doing the things that I've seen that needed to be done, like a project in my house of whatever it was, cleaning that out, addressing the pile of, clothes that accumulated over 4 years in the garage or whatever it was. I would just look at it and be like, oh, I'm not going to do this. I don't have it. So I'm starting to do those things, and having the mental acuity, or I don't know exactly if that's the right word, just to be able to sit down and say, okay, I'm going to tackle it this way, and giving myself enough of a manageable thing so at the end of the day, I'm not like, what did I do all day? Mm-hmm. I can see that I had a result. So that helps me continue. So it's sort of like, if you can keep going, that's the other part of having the energy, is being able to know, it's sustainable.
Yeah, just being more on top of like day-to-day life, everything.
Yeah, and I have 3 kids, and there's a lot that goes with that. Even if they're older and they can do most of the things, there's still, I have a girlfriend living with her, with one of my kids, and so there's people in the house, and there's stuff going on, and I think if I had gotten a rescue dog 2 years ago, I would have been a fail. Mm-hmm. And she's a good dog, but like I have the energy to deal with her and her little weirdness and whatever.
That's awesome.
And
that's so exciting. Is there anything else you feel like would be helpful for somebody who's kind of looking at functional medicine, thinking about working with us, that would be helpful for them to know?
Well, I think, like, don't be scared by the word functional medicine, because I think I've had to explain that to people a lot, and just about the cellular pieces and that kind of thing, and that there's no stupid questions.
Yeah.
And like Dr. Rose is really good, because like today when we were having a lot of discussion about different things, I was like, wait, can we just go back to something for a second? And really patient, and there's nothing stupid. I mean, I know they always say there's no stupid questions, but there really aren't. And a lot of this is new to me and other people, and I think while it is intimidating, I don't feel intimidated when I'm here. And everybody who I come in contact with here has been really sweet, and I enjoy talking to them.
Thank you so much, Elizabeth. I appreciate that.